Mouth sores can be a problem for individuals who are undergoing chemotherapy. We have other names for this. We may call it stomatitis, or we may call it oral mucositis. Typically, when people have mouth sores from chemotherapy, it will take the form either of something that most of us have, small canker sores, or it can be much more severe where you have areas of redness, large areas of sores, and they can even be covered with a gray or white coating, a type of debris. The reason for these mouth sores occurring happen because the normal bacteria, what we call the normal flora of the mouth, is altered by the chemotherapy. And the lining then can become distressed, and so you develop these sores. In addition, individuals who have poor dental hygiene are also at higher risk for developing the mouth sores because already either their mouth, their tongue, their teeth, their gums are already compromised. What is strongly recommended is, if at all possible, before you receive chemotherapy, that you have good dental hygiene, that you go to your dentist, you have any cleaning done, that any dental work that needs to be taken care of is taken care of. Then during the course of chemotherapy, you want to take good care of your mouth. You want to brush your teeth with a very soft toothbrush. You want to do it frequently, and you want to do it very gently. In addition, what we often recommend is that individuals rinse their mouths with baking soda and with salt water, typically a teaspoon of baking soda with a glass of warm water, rinsing your mouth out 4, 5, 6 times a day. Another very common combination is a half teaspoon of salt and a half teaspoon of baking soda, and rinse your mouth out, again, 4 to 6 times a day. Once one receives, if one happens to get mouth sores, it's recommended with the rinses that I just talked about. But in addition to that, you need to make certain that you're eating and drinking enough. It becomes complicated because now your mouth is very painful. You don't want to eat, you don't want to drink because it hurts, but in fact it is even more important that you have enough fluid and that you have adequate nutrition so that the cells are able to repair themselves. If you have a lot of pain, there are many sores, it is very important that you call your clinic, your oncologist, so that you can be evaluated for this. In these settings, frequently medications are indicated, and over-the-counter drugs or other remedies may not be effective.